Hello, my name is Jodee and I'm a speech and language therapist. I'm going to talk to you about how we swallow and what happens when things go wrong. Swallowing is a complex process which uses some 50 pairs of muscles and many nerves to get food from the mouth and into our stomachs. Let's have a look at some of the structures involved in swallowing. Here's an image to show what it looks like on the inside of the mouth and throat when we swallow. As you can see here, we have your chin and your teeth, familiar structures, and the lips here. Inside we have the hard palate here. If you run the tongue over the top of your mouth, you can feel it's hard, and as you go further back you get to this soft bit at the back of your mouth. This is called the soft palate or the velum. This is an important structure when we swallow because it lifts up to block off the nasal cavity, which is here. Have you ever had a time when you've got lemonade up your nose when you were laughing or talking? That's because when we talk, this nasal cavity tends to be open and this soft palate opens and closes, but when we swallow it closes off, and its function is to stop that lemonade or the food going up into your nose. As you can see here, this structure here is the tongue. It's massive. The bit that we can usually see is the tongue tip. It's just this little bit here, and the body of the tongue here. But actually we already talked about the many muscles that were involved with swallowing, and the tongue is layered with muscles going up and down, back to front, and attaching to different structures in the mouth and throat. The tongue is such an important muscle that's used in chewing and swallowing. To move food around your mouth, to push it back into your throat, and to swallow are all essential parts of the tongue's movements. The chewing and moving of food in the mouth is called the oral phase of swallowing. When the tongue pushes the food into the throat, we enter the pharyngeal phase of swallowing. This is named after the pharynx, which is the medical term for the throat. So let's have a look at the structures involved. At the back here we have the pharyngeal wall. In other words, the many muscles of the throat which help you to swallow. Food is squeezed from the top all the way down in a process called peristalsis. You'll see here a structure, a cartilage, where your voice box is. We call this your larynx. And here you have your epiglottis, which is like a little flap. Your larynx sits right above your airway. And at the back here you have your food pipe. So when we swallow, your larynx or your voice box moves up and the epiglottis moves down to close off your airway so that your food and your drink doesn't go down the wrong way. And finally, you'll see down here are your vocal cords or your vocal folds. These are important in swallowing because they squeeze very tightly to help close off your airway. If you manage to get food or drink that goes down the wrong way, it often makes you cough. This is your cough reflex, which is triggered by the sensation of feeling something on your vocal cords where they shouldn't be. So let's have a look at the swallowing in motion. I'll slow that down for you. As you can see, the food is in the mouth. The tongue pushes the food to the top of the mouth, up here, onto your hard palate, and it squeezes. As it squeezes, you will see that the soft palate has now moved to seal off the nasal cavity, and the tongue is pushing the food back into the mouth. You can see here already that the larynx has started to move up and the epiglottis has started to move down to stop the food or drink from going into the airway. And as you can see here, it goes into the food pipe.